All right. If you'll take your seats, we'll get started shortly. Rik Peeperkorn, the World Health Organization representative in the Occupied Palestinian Territory, will talk to you. Just one second, and we'll get started. Okay. Oh, great. We see him up. All right. Good afternoon, everyone. We're very pleased to have with us at the start of this briefing Rik Peeperkorn, the World Health Organization representative in the Occupied Palestinian Territory, and he's here to talk to you about the latest situation in Gaza, including what happened in Deir al-Balah yesterday. Mr. Peeperkorn, the floor is yours.
Good evening. My name is Dr. Rik Peeperkorn. I'm the WHO representative for the Occupied Palestinian Territory. So let me come with an hopefully brief statement and then take some questions.
There's just a slight echo. One slight echo. Okay. I think you can proceed.
Excuse me. I mean, I heard an echo.
Yeah.
Okay, let me continue. I hope you hear me loud and clear. The evacuation orders in Gaza have severely affected the WHO, but I want to stress we remain on the ground, we stay and deliver, and we will expand our operation. Let me describe the situation. Yesterday, 21st of July, following intensified hostilities in Deir al-Balah, after the latest evacuation orders issued by the Israeli military, the WHO staff residence, WHO, and resident actually for the national staff was attacked 3 times on the 21st of July. Personnel and their families, including children, were exposed to grave danger and traumatized after airstrikes caused a fire and significant damage. Israeli military entered the premises, forcing women and children to evacuate on foot toward al-Mawasi amidst an active conflict. The male staff and male family members were handcuffed, stripped, interrogated on the spot, and screened at gunpoint. 2 of this WHO staff and 2 male family members were detained. 3 were later released, while 1 staff member remains in detention. 32 people, including the women and children, were collected and evacuated to the WHO office in a high-risk mission. Once access became possible, all carried out by the great WHO team in Gaza. The office itself and WHO cold chain are close to the evacuation zone and active conflict. Now, and talking about today, most of WHO staff housing is now inaccessible in Deir al-Balah. Last night, due to this intensified hostilities, 43 staff and their families, they were already relocated from several staff residences to the WHO office under darkness and significant risk. In another event, which is incredibly serious and devastating, WHO main warehouse, we have 3 warehouses, but our main warehouse located in Deir al-Balah and within the evacuation zone was damaged, destroyed yesterday after an attack which caused explosions and fire inside. We see this as part of a pattern of systematic destructions of health facility. We also understand was reported that was later looted by desperate crowds. There's a few key messages I want to convey. First one, with the main warehouse non-functional and a majority of medical supplies in Gaza depleted, WHO is severely constrained in adequately supporting hospitals, emergency medical teams, and health partners, which are, as we know, already critically short on medicines, medical supplies, fuel, and equipment. So, WHO, we urgently call on member states to help to actually increase the support to WHO and to help ensure a sustained and regular flow of medical supplies into Gaza. We were lucky that actually the same 2 days ago we brought in some medical supplies, and fortunately we brought it into our other warehouse. But a lot of the medical supplies, and there were substantial medical supplies in our main warehouse, they of course are these supplies are destroyed. The second message which I want to raise is that as WHO we call for the immediate release of the WHO staff member detained yesterday and the protection of all our staff and its premises. We reiterate our call for the active protection of civilians, healthcare and its premises, and for the rapid and unimpeded flow of aid. Over to you.
Real?
Thank you, Rik. I appreciate the briefing. A couple quick follow-ups. Number one, I think I heard you say that you're going to expand your operations in Gaza, if I heard you correctly, in the beginning of your remarks. Is that correct? And I sort of read that as defiance by the WHO against Israel clearly attacking the organization. A, did I hear you correctly? And B, is that a correct way to characterize how do you plan to expand operations is what I'm getting at. I'm sorry. The second question is, can you give any more details about the staff member that is still being held by Israel, and what does Israel tell you why they're holding him? And last but not least, the warehouse that was destroyed, can you give us more details of what exactly was in that warehouse, and is everything lost? Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.
Yeah, so let me first try to address your first question. Yeah, this is not a moment to be desperate and to be packing up. This is a moment to reorganize, reflect, and see indeed, like, and plan how we can expand. And we are already doing that with our team in Gaza and Jerusalem and the West Bank, but also with support our regional office and our headquarters. As I said, WHO is the within the one UN, we're the lead agency with regard to health. We're the main provider for medical supplies, essential medicines, medical supplies in Gaza. Fortunately, we have two other warehouses. So WHO, what is our focus currently? The focus is, of course, all about saving lives and reducing morbidity. And how do we focus on that? And what have we done from the start of this crisis? We focus on medical supplies, essential medicines, medical equipment, the whole operations, supply and logistics. That's the huge component of that. And we will and we want to expand. Of course, this is also a call out to member states. So we will immediately look for other warehouses, etc., and we'll try to make sure when supplies come in that they will be stocked in the other warehouses, and actually go as quickly as possible to the hospitals, health facilities, now health partners, which so desperately need those supplies. That is one. The second component is the WHO does supporting emergency medical teams, getting them in, not just international but also national emergency medical team, getting them in, making sure that they are located at the right facilities, hospitals, and support them as good as possible. Yes, we want to continue with that. You probably heard and read a lot about our support and management of medical evacuations of the critical patients who need it. We estimate still more than 10,000 patients in need to be medical evacuated outside Gaza. half of them related to the conflict, probably roughly 40% more chronic diseases, cancer, etc. We have been continuing that. Then we continue in assisting the hospitals and health facilities, mass casualty management, etc., and other training and capacity building. So it's a call out and definitely, yeah, defiance. I don't even know that it's more needed than ever. Let me say it this way. So yeah, we will definitely continue and expand. We are there to stay and deliver. That's the message, and to expand. The, the second question you had about the staff member, he's a caretaker, cleaner of the office. I don't, I cannot provide you any more details on that. We haven't heard anything. It is constantly raised with the Israeli authorities. They're very much aware of this, and we demand his urgent release. When it comes to the warehouse, and this is maybe where you know, of course, I'm most concerned is about my staff, the national staff, international staff, my teams, and coming every other month in Gaza and working there. I know exactly where they have gone through. I mean, through this horrific crisis of over almost 2 years. So this is, of course, our key focus: is our staff and the protection of them. I just want to mention a point which is critically important, that all the UN staff houses, also UN, WHO, staff houses, warehouses, including from international partners, NGOs, etc., all the coordinates are very well known with the Israeli authorities. They are regularly updated, and we are supposed to be protected and actually facilitated. Now, similarly, this applies for the warehouse. And the warehouse, absolutely don't get it, that a warehouse where everyone knows is the main WHO warehouse and the main storage for those scarce and so much needed medical supplies, that has been attacked and hit and indirectly then set on fire. And yes, it is for us. We haven't been able to visit it, but from all the reports we get, and also the mission who extracted the people, the staff yesterday, they were very close by, based on their observations. Yes, it is very much destroyed. And it had a substantial supplies of essential medical supplies and medicines. And for example, the types which are most needed: trauma and surgical supplies, assistive devices, essential medicines like key antibiotics, but also cancer medication, diabetes medication, dialysis supplies, etc. Even a little bit of therapeutic milk we want to get more in. I could mention a whole lot more: blood units, anesthetic drugs, etc., etc. Over to you.
Questions? Yes.
Hi, I'm Kyoto Tanaka from the Asahi Shimbun, a Japanese newspaper. Just two questions. One question about the WHO staff detained. At this moment, is it just one staff being detained?
Yeah, you're right. I can confirm at this moment it's just one staff member which is detained. So 4 were detained during that operation. 3 were released. 1 is still detained. I just want to mention this. Please speak clearly because there's a huge echo from your side. Over.
All right, thank you. And I just want to clarify where you are talking from.
So currently, I'm the WHO representative. Actually, I was supposed to be on leave. I'm talking from the Netherlands, and my last mission to Gaza. So I come every other month in Gaza. My last mission in Gaza was 2.5 weeks ago, and I think we very much reported, I think, on that on those missions as well. Maybe you remember that we reported a lot on the mass casualty incidents which we observed, mostly related to the so-called safe non-UN food distribution sites, and that the hospitals we support, and then major hospitals, they're National Medical Complex and Shiva Hospital in the north, National Medical Complex in the south. That unfortunately, what I observed was the same as the first 6 months during this crisis, that they have turned into one massive trauma wards because of the current situation. Over to you.
Michelle?
On sort of, we're seeing deaths from starvation now, and the rates of malnutrition soaring, as the Secretary General mentioned this morning. Do you have any sort of specific data you can share with us on that?
Let me say, I don't have current data, and I will ask my team maybe to provide you some data, but let me say this way. We have gone through a cycle before. Maybe you remember in January, February, and March this year, there was also this cycle of hardly any aid coming in and malnutrition levels going up. Now, having been coming into Gaza, I mean, for the last 4.5 years, so malnutrition was never an issue in Gaza. The malnutrition level among infants and under fives was less than 0.6, 0.5% or something like that. What we currently have, and then I remember in January, February, we saw this huge increase in malnutrition among under fives. Huge increase. And currently you talk literally about hundreds and hundreds of kids who are malnourished all over Gaza. But also it has a huge effect on pregnant and lactating women, which was never, before the crisis, was never an issue in Gaza. There was never any malnutrition. So the nutrition rehabilitation centers, which were supported by WHO and UNICEF, for example, in the north, in Kamalat 1, that's not functional anymore because that hospital is not functional anymore. The few other ones in patient-friendly hospital in the north and in the south, I think there's one or two in the IMC Field Hospital, which WHO also supports, etc. Everywhere, there's a stark increase reported on malnutrition among under fives, but also among adults. We see, and because there's not only a lack of food overall, but there's a lack of diversified foods all over the place. So yeah, it has a huge impact. There are some data from the nutrition cluster. We're talking about a real serious problem. You're talking about hundreds of children which are now malnourished and which should never be malnourished. We have seen we've all seen, and we reported on that as well, the horrific cases when you talk about severe malnutrition. And I remember the last time I was in one of the rehabilitation wards, you look at a girl of 5 years old, and actually as a medical doctor you assess, you think that she's 2 years old, etc. You get that and you see that. Over to you.
Questions in the room? Yes, please. Last question.
Apologies if you already mentioned this at the beginning. How many hospitals are functioning right now?
Okay, so there's roughly 17, 18 hospitals, which are, I would say, partly to minimal functional. And some of them, the most important ones, like for example, National Medical Complex, was constantly and it's the main referral hospital currently operating in Gaza, was constantly within an evacuation zone or just bordering an evacuation zone. So also the access becomes much more difficult for people. That hospital, when I was there last time, 3 weeks ago, It had tripled. It was what I said. It was one massive trauma ward. You saw trauma. It was just if I was back in the first 6 months of this crisis, you saw trauma patients all over the place, in the corridors, of course, the trauma ward. You saw the an ad hoc improvised intensive care units being made in corners, in small rooms, etc., and patients being intubated on the floor, mainly young boys, boys, men. I remember I talked to a family of a 13-year-old which was shot in the head while trying to get food in one of those so-called safe non-UN food distribution zones. And he died, he passed away, struggling for his life, passed away a day later. There was another family I talked to, another young boy, I think 18, 19, also shot in the head, etc., struggling for his life. A boy of 21, I'll not forget that, with a bullet still lodged in his neck, around the C2, quadriplegic. Also, the same story, went out to get some food in one of those so-called safe non-UN food distribution sites, etc., and were shot. And we saw so many of these injuries. I mean, and mainly what I say, boys, young men, shot in the head, in the neck, in the chest, in the abdomen, on the knees, etc. Horrific injuries. Over to you.
I know that that you have to be someplace, so I will now let you go to your appointment, and thank you very much for sparing time to give us the details on this. So once more, we'd like to thank Dr. Rik Peeperkorn, the WHO representative for the Occupied Palestinian Territory, who's calling in from the Netherlands. Please stick around, and Stefan will do the regular part of the noon briefing, along with our guest, Maximo Torero, the chief economist of the Food and Agriculture Organization. Thanks.
I want to stress, what we see now and what's happening and what is needed most. The first thing what is needed most in Gaza, to flood the market with food. That's how you avoid this mass casualty incidents. Flood the market with food. Ensure that water and wash supplies are there. Ensure that WHO can get in a regular supply of essential medicines and medical supplies. And of course, fuel, which is underpinning everything and is absolutely needed, a regular supply. And even if there's an ongoing war or hostilities, then there's still an obligation to create humanitarian corridors so that UN, WHO, partners can do their work. Last but not least, of course, a ceasefire is long overdue. Thank you.